Yeah, about other symptoms of endometriosis, because this is a strange disease and it can come by different shape. So first of all, if it affected the bowel, and you may be confused for a long time in your life with irritable bowel syndrome, because if it's just a spot, these spots in the bowel or on the rectum can cause any of diarrhea or can cause constipation. And of course, will have bloating. And a very recent study was done in Manchester where they fulfilled the rectum of endometriosis patients, mild endometriosis, severe endometriosis, irritable bowel syndrome, and normal ladies with just minimal gases. And they found very interesting that the threshold of pain of normal people here and with endometriosis, mild, moderate, severe, and the IBS, all were very low threshold for pain. So it's not related to the symptoms, not related to the severity of the stage or anything. Once you have endometriosis, you may have abnormal tolerance for the pain inside your colon. And this will reflect also in the muscle of your pelvis. So if you have constipation, you will need to do a spasm in your pelvic muscle, and this spasm can cause pain, and it may cause pain inside the intercourse also. And if you have diarrhea, you are exerting more effort to hold this diarrhea, and this also strain on pelvic muscle. And this strange kind of pain can cause you to have very strange pain, and nobody can figure out it. If you went for examination by a gynecological doctor, he will not find anything. We don't have any method to prove that it's deep pelvic muscle pain. We do not know it. It's not in common practice between obstetrician, between gynecologist, or even between gastroenterologists. Is a common practice. And bloating effect also can happen due to this irritability of the colon all the time. So you may not complain of dysmenorrhea, dyspareunia, or pelvic pain, but you will have this strange feeling that something is spastic, and this pain can sometimes be very disabilitating for your movement. So this is very strange syndrome. That's why nobody listen to these words. And if we are thinking to treat endometriosis, when we treat it by giving hormone contraception, by giving any painkiller, still she's complaining of pain because the threshold once if per se you touch the hot oven every time this hot oven you see a hot oven so you will just move quickly. Same with endometriosis. If you felt this pain and you start to treat it, but you still have this memory, once anybody touches this muscle again or just any kind of pain, so you will exaggerate it. Okay, so this is very strange. So it needs to be tackled and be explored and be spoken up by a cognitive behavioral therapy could help you. You can speak with yourself. Okay, so I know if it's not related to the period, maybe I'm exaggerating my response now. This can help. And sometimes it could lead you to just sleep and don't move and rest. Okay, but this will not help. Unfortunately, this will not help. Try to just move your body a little bit, just doing easy move or easy steps. Some exercise. I will not say just belly dancing or any blanks, so this will not help at all. But just try to keep your body just moving a little bit to just decrease this response to pain. If you rest, it will increase more and more. Just to try to move, but not doing any core exercise, definitely, if you have such kind of pain. This is one thing related to the abnormal symptoms of endometriosis, which is not revealed until now. The second thing, if it's bladder endometriosis, which is very common, especially in advanced disease, to have endometriotic glands or islands implanted inside the bladder or implanted inside the ureter. So you may have chronic UTI and you are going to the hospital, you have some bloods in your urine, doing investigation, doing anything, we can't find anything, we put you on antibiotic because it's loin pain and flank pain, typical size, typical pain of endometriosis. It's not typical pain of endometriosis. You are treating it something related to the urinary tract. And if you are going to the generalist, so they will not, of course, they will not think of something abnormal with this, okay, unless they are taking very detailed history about what I told before. Okay, so it can come by bladder pain syndrome, urge sensation all the time. You want to go to the toilet and you have pain and nothing there in the urine. You are doing urine test, it's fine, it's completely fine. So inflammatory response inside your tummy could exaggerate this response of urinary symptoms, excessive unexplained urinary symptoms. Excessive unexplained, we just relax our mind, it's IBS. So it's IBS. And what can cause problem worse when any clinician put you in any pain relief and now very recently they are using cannabis and or opiates, and opiates and cannabis will make this problem worse more and more because it will just cause constipation sometimes, cause more bloating in your tummy, so it will exaggerate the symptoms. So are exerting many effort to put people away from cannabis rather than prescribe it because it's sometimes not helping. It's still very new study because many new research about cannabinoids on endometriosis, but we'll just discuss this later as an option of treatment. So this is very exaggerated symptoms. Sometimes it could cause, if it's just implanted in the lung, maybe cough of bleeding, maybe bleeding epistaxis. And the weird thing that it's abnormal disease, they found endometriosis gland inside a male was bleeding from his nose. So this is very strange. This give explains that it's what's happening. Maybe these pre-genetic cells that implanted in each place in your body. So it's very strange disease.